in the right environmental conditions, indoors on certain surfaces, the virus may last several days. The amount of virus goes down every day, but you can still detect small amounts. So if anybody's in public, any public surface, as particularly indoors, should be suspect. And that's why you want to observe good hand hygiene. You know, if you've been in the grocery store, grabbing the grocery cart, if you have to go grocery shopping, that's fine. But when you're done with the grocery store, clean your hands, soap and water or hand sanitizer.
Answer your questions about the COVID-19 outbreak. The question today, how long can the coronavirus live on different surfaces? Everything from the fridge handle or fabrics like cloth masks we wear. KELBO's Tammy Watasa is live in the newsroom with today's answers. Tammy?
Mary, so many questions because we're always touching our food, masks, and surfaces, which is a big part of the concern with COVID-19. Experts are still doing a lot of research, but they're also learning a lot to help keep us safe. I got this question on my Como News Facebook page. Can the virus spread from all the masks and gloves that people are using and disposing of into public garbages? Just wondering, once these go into the landfill, can it continue to spread and survive?
That is a great question. So certainly the virus can live on surfaces for at least a few days, depending on the type of surface. We know that much. I think it's really important to understand that when we're using cloth masks in particular, or gloves, let's say, that we're wearing out into public, that we take those on and off in the proper way and that we clean them.
A new study from the National Institutes of Health found the COVID-19 virus can survive up to 3 days on plastic and stainless steel. It was detected on copper up to 4 hours, on cardboard up to 24 hours. It can also linger in tiny particles in the air for up to 3 hours. Here's another question I got. We've been hearing that COVID-19 will stay alive in our freezer products for years. Is that true? Research is ongoing for COVID-19, but according to this study from the American Society for Microbiology, similar viruses like SARS thrived in low humidity and temperatures below 40 degrees Fahrenheit. That's the same environment found inside a typical refrigerator.
To be in a freezer for years would be highly unlikely that the virus would survive and then survive the thaw. But I think best practice here is just to disinfect the outside of everything. And the great news about freezer foods is there's no food going into the freezer just open without any packaging.
Evergreen Hospital was ground zero for the treatment of the first critical coronavirus cases in the U.S. Dr. Ryan Pageant, an emergency room doctor at Evergreen Health, was on the front line. By mid-March, he was critically ill on life support with COVID-19. He was moved to Swedish Hospital, where he was treated with an experimental drug called Actemra.
I think it would be fair to say we have treated patients with this medicine who seem to be quite ill and have gotten better.
And that was the case for Dr. Pageant. The drug, which is used to treat arthritis, is showing some promise in COVID patients whose bodies have a vigorous immune response to the virus.
We do know that when that occurs, when the immune system is really maybe perhaps overactive, that can make patients very, very sick in a short period of time.
Swedish says they've treated 40 COVID patients over the last 2 weeks with Actemra after a small Chinese study that showed 21 COVID patients with high levels of inflammation had been successfully treated with the drug.
I think it's still early to tell what role this medicine may have, but we've developed quite a bit of experience with it to this point already.
For the Kirkland doctor, the drug lowered his inflammation levels and his oxygen levels increased. After a week, he was well enough to be taken off life support. Medical trials will eventually determine if this drug will save more lives.
The best medical treatment really for any disease is to prevent it.
When the weather is this good, it's hard to think of a better spot to soak it all in than Alki Beach. Clearly, everyone here has that same feeling. But with concerns surrounding COVID-19 still very much in play, this slice of sand will soon be closed.
I get what they're talking about, but I don't think what we're doing now is really the answer.
It isn't the only park being shut down by the city to help curb the spread. 15 of Seattle's hottest hangouts in all. That includes Capitol Hill's Cal Anderson.
This is the only park that's convenient in this area, and people are very respectful.
And no more rollerblading, setting up that hammock, or hitting the water at Green Lake.
We know this puts a big burden on people because we all love the parks.
Mayor Jenny Durkin says with the Easter weekend approaching and crowds continuing to show up at these places, it's a move that must be done to maintain social distancing.
And we've seen an uptick in gatherings and barbecues and picnics and soccer games. And we just can't do that.
All neighborhood parks will remain open, so there's still a chance to get outside.
We all want this to end as soon as possible and to be able to start the business of opening up our city again.
Okay, so all of this goes into effect tomorrow night at this time, 11 o'clock. Those parks are set to reopen early Monday morning. The mayor says that the Parks Department is going to be keeping a close eye on things, monitoring all of this, and if warranted, those closures could go on. Back to you.
Cole, thank you.
And we know you have a lot of questions on COVID-19 as the situation changes every single day. We're here to help, and so is our 9 Health expert, Dr. Pyle Coley. She joins us live this morning to answer some of your questions. Hey, Dr. Coley, good morning.
Hey, good morning. How are you?
I'm doing well. I'm doing well. So the first question comes from a viewer who asks, how do people without symptoms spread COVID-19 if they aren't coughing or sneezing?
Yeah, so with the SARS virus, actually, the virus replicated deep down in the lungs. So you actually had to cough or expel respiratory droplets in order to spread the virus. But the interesting thing with this virus is it replicates in the nose. And so even as we're talking, we spread respiratory droplets. And so for those people that don't have symptoms, they're not coughing, they're not sneezing, the virus is replicating in their nose and they're shedding or dropping these viral particles as they're talking. And that's why that social distancing is so important, because if you're not close to that person within 6 feet, then it's unlikely that those viral particles will get to you.
That's very interesting. And next question is from someone who asks, how long does the virus last on clothing?
Yeah, so we've wondered this ourselves as physicians because we're wearing clothing that's going from the same room to room. And interestingly enough, it has not actually been studied formally. But clothing is a soft surface. It's called a porous surface, unlike plastics or steels, which are called hard, non-porous surfaces. So we expect that it doesn't last as long on clothing as it does on harder surfaces, but we're still thinking probably hours to days. Now, the one interesting thing about clothing is we often have buttons or zippers that are made of either plastic or steel or some other material, and it can certainly last for up to 3 days, as we found out. So it's really important to treat clothing as if it's contaminated if you think you've been in contact while you're wearing your clothes with somebody who may be, shedding the viral particles.
In the same line of questioning, the final question is from a viewer who asks, do we need to take any precautions handling the products that we're getting at grocery stores? So what about the fresh vegetables? Is it just washing with hot water? Would that be enough?
Yeah, so the fresh vegetables that are not packed, I generally tend to use water and dish soap, because we do know with our experience from hand washing and the science about the virus that soap is much more effective than just water alone. So water does get rid of some viral particles, but you really need that soap to inactivate that outer membrane of the virus. So if something's not wrapped, like bell peppers, tomatoes, or something like that, then I usually wash it with soap and water. If it's wrapped like spinach, then I usually kind of just wipe down the bag with a sanitizing wipe.
All right, Dr. Coley, thank you so much for the great advice.